Good evening, ladies and gentlemen. My name is Jagdeep Aluwalia, and I'm the founding secretary of the Indo-American Chamber of Commerce of Greater Houston, which I currently serve as executive director. Join me in thanking Dr. Mridul Patel from MD Anderson and her colleague, Laura De La Rosa, for accepting our invitation to make a very important presentation today. I want to start off by introducing our Chamber Executive Committee, our Board of Directors, our directors at large, and our advisors. We miss Dr. John Mendelson, who was on our advisors till he passed away last year. And I'm proud to be wearing this tie that he gave us when we took him to connect with a similar center of cancer excellence in India, the Tata Cancer Medical Center. Today's webinar will be recorded and the recordings will be shared later. We will be live on our Facebook page and on the Facebook pages of our supporting organizations. We are proud to be serving the business community for over 21 years, and we work closely with our sister chambers and our sister associations. On behalf of the Chamber, we want to thank our collaborating organizations today, the Asian American Hotel Owners Association, the Argentina Texas Chamber of Commerce, Club 24, the members of the Davodi Bora community, the Indo-American Cancer Network, the Indo-American Political Action Committee, India Culture Center, the Indian Doctors Association, the Indian Muslims Association of Greater Houston, India House, the PhD Chamber in India, who will be sharing this recording with their members, Seva International, who have been a strong supporter of the Chamber and have been instrumental in reaching out to their Facebook account and helping us get this program out to people in the hundreds, if not in the thousands. The Small Independent Motel Owners Association and TAI Houston. We want to thank our partner organizations who help promote our events on a regular basis, our media partners who help with the reporting of the events, publicizing before and reporting afterwards. We want to thank our long-term sponsors whose support helps us to continue to serve the community, Brask Inc., Lyondell-Bissell Piping Technology, and Shipcom. And we want to recognize Shell for supporting our Women Mean Business and the Shell Distinguished Lecture Series. Our next Women Mean Business event is on December the 15th. I would now like to invite the Indo-American Chamber President and the Chairman of our board, Tarush Anand, to make his welcome remarks. He will introduce Laura De La Rosa from MD Anderson, who will moderate the discussion. Laura will introduce today's keynote speaker, Dr. Mridul Patel, and I will be back at the end of the program to propose a vote of thanks. It is now my honor and privilege to invite Tarush Anand, the President of the Indo-American Chamber of Commerce and the Chairman of our board, to make the formal welcome remarks. Tarush is an attorney by profession, a partner at the law firm of Brown Sims, where he practices civil litigation. He has represented a broad range of domestic and international businesses in various types of business disputes across the country. We are proud to be led this year by Tarush Anand, the President of the Chamber. On to you, Tarush. Thank you.
Thanks, Jagdeep. Good afternoon, everyone, and welcome to today's webinar. We are glad you could join us. The Chamber of Commerce has been around for 21 years now. Come this June, it'll be 22 years. And our primary goal is to serve the business community here in the Greater Houston area, to facilitate trade between India and commerce, and to provide support to businesses and professionals and help them grow in whatever field they choose. But beyond that, over the years, we have also undertaken a role to help the community in whatever general needs it may have. And we've partnered with other organizations to provide key services and information to the community at times where it's important. The pandemic obviously has created challenges for many businesses, but I am sure it has created health-related concerns as well. I know from a personal basis, my dental work is probably way overdue. And while you can fix crowns and get an extra root canal, when it comes to cancer, I think the consequences are much greater. So I think this is an important and timely program, and I thank MD Anderson and Dr. Patel for agreeing to host it for us. So with that, let me move on to introducing Laura De La Rosa of MD Anderson. Laura is a senior community relations specialist in strategic communications at the University of Texas MD Anderson Cancer Center. She coordinates charitable sponsorships that support the local community and collaborates with nonprofit, civic, and business organizations to educate the public about cancer prevention. She received her undergraduate degree in social work at Stephen F. Austin State University. We're really glad she can be here with us today. Welcome, Laura.
Wonderful. Thank you so much, Tarush. And we would like, MD Anderson would like to thank the Indo-American Chamber for this opportunity. I am very excited today to introduce our speaker to you. Dr. Patel received her combined MDA BLA degree and completed an internal medicine internship at the University of Missouri, Kansas City. Afterwards, Dr. Patel completed her radiology residency at UT Houston. She then finished a year of fellowship in diagnostic imaging with a focus on breast body imaging at MD Anderson Cancer Center. Dr. Patel's clinical focus is on advancing our mission in the early diagnosis and management of breast cancer in the community through a multidisciplinary approach to obtain optimal treatment outcomes. Her current areas of research include primary angiosarcoma of the breast and imaging of the breast post-breast conservation therapy. She also has an interest in resident and fellow education. Outside of work, Dr. Patel enjoys traveling. We're very excited to now introduce Dr. Patel.
Good afternoon. Can everybody hear me?
We can.
Thank you for joining us today for this presentation. I'm glad we're able to connect even in times of social distancing. Laura, can you confirm that my slides are showing appropriately?
They are, Dr. Patel.
Okay, I'm just trying to fix this. Go. Before we get started, I want to mention that even though I am at MD Anderson today and we require all employees to wear masks, I'm in an office by myself, so I've taken my mask off so that you can hear me better. And thank you, Laura, for that wonderful presentation about myself. A quick reminder, the best things you can do to prevent the spread of COVID-19 are: 1, practice social distancing by staying at least 6 feet from other people. Wash your hands frequently with soap and water for at least 20 seconds. And wear a mask or cloth face covering over your nose and mouth in public. Remember, getting tested when appropriate empowers you to protect others. So let's begin with some basics about cancer. Cancer is not a single disease, but a group of more than 100 diseases that occurs when there is uncontrolled growth of abnormal cells. So when these cells build up to the point that they become an abnormal tissue mass, it's called a tumor. Not all tumors are cancer. Benign tumors occur frequently and are not cancer. They can usually be removed. They do not spread to other parts of the body and are rarely a threat to life. Malignant tumors are cancerous and may spread or metastasize to other parts of the body. So what makes up the breast? The breast sits on the chest muscle that covers the ribs, and each breast is made up of 15 to 20 lobes. Lobes contain smaller lobules, and the lobules contain groups of tiny glands that produce milk. So milk flows to the nipple from the lobules through thin tubes called ducts. The nipple is in the center of the dark area of the skin called the areola, and fat fills the spaces between the lobules and the ducts. The breasts also contain lymph vessels, and these vessels lead to small round organs called lymph nodes. Groups of lymph nodes are near the breast in the underarm, above the collarbone, in the chest behind the breastbone, and in many other parts of the body. The lymph nodes trap bacteria, cancer cells, or other harmful substances. So this is interactive. Click the thumbs up button if you think breast cancer is the most frequently diagnosed cancer in women. And the answer to that is true. While mammograms are an important way to find breast cancer early, you should also know what signs to look for to know if something could be wrong. Symptoms to look for include a lump or mass, enlarged lymph nodes, changes in the breast shape or size, dimpling or puckering of the skin, scaliness of the skin, nipple changes or discharge, and the nipple pulling to one side or a change in direction of your nipple. Remember, talk to your doctor if you have one or more of these signs. And don't let COVID-19 prevent you from making an appointment right away for any of the symptoms or warning signs that do persist. Just as cancer is not a single disease, there are actually different kinds of breast cancer too. So breast cancers may be invasive with a potential to spread, or non-invasive, which is also called in situ. The most common form of breast cancer is ductal carcinoma. In this type, tumors form in the cells of the milk ducts. Lobular carcinoma occurs in the lobules, where milk is produced. And it's important to note that Black women get an aggressive type of breast cancer called triple negative breast cancer more often than other women. It is called triple negative because these cancers are missing a specific protein along with 2 hormone receptors found in other kinds of breast cancer. This means that some of the usual treatments won't work in this type of cancer. Now, inflammatory breast cancer is extremely rare, fast-growing, and lethal. Often, women mistake it for something other than breast cancer, such as a rash or infection. About 1 to 5% of all breast cancers in the United States are inflammatory breast cancers. Click the thumbs up button if you think breast cancer can occur in young women. This is true. Breast cancer can and does occur in women of all ages. So am I at risk for breast cancer? No one can say if you will get breast cancer, but there are factors that may increase your chances for the disease. You are at increased risk for breast cancer if you have 1 or more family members who have had breast and/or ovarian cancer. Remember, inherited susceptibility genes such as BRCA1 and BRCA2 account for about 5 to 10% of all breast cancer cases. You are also at increased risk for breast cancer if you received radiation therapy to the chest between ages 10 and 30, or if you have had breast disease, such as lobular carcinoma in situ or atypical hyperplasia. And these are usually found on prior biopsies or excisions. You are also at increased risk if you have a combination of reproductive factors, such as starting your period before age 12, starting menopause after age 55, having your first child after age 30, or never having children. Individually, these are not a cause to talk to your doctor. However, 2 or more reproductive factors, or 1 or more reproductive factor in combination with one of the other risk factors I mentioned, might increase your risk. Now that you've learned a little more about breast cancer, let's talk about actions you can take to lower your risk and tests that your doctor can use to detect breast cancer in its earliest and most treatable stages. As with anything else, keeping a healthy weight and a low amount of body fat can help lower your risk. Eating a healthy diet can help you achieve this. So we recommend filling 2/3 of your plate with plants at every meal. Plant foods include vegetables, whole grains, and fruit. If you need to lose weight, eat fewer calories and burn more calories by exercising. Also, remember, good nutrition during stressful times can boost mood, prevent unwanted weight gain, and strengthen your immune system, which will also help you fight viral infections like COVID-19. Sitting too much increases body fat, which leads to cancer and other chronic diseases. Aim for at least 150 minutes of moderate exercise, such as walking or yoga each week. If you prefer more intense exercise like running or swimming, get about 75 minutes a week. And do strength training exercises at least 2 days of the week. Strength training helps you maintain a healthy weight because the more muscle you have, the higher your metabolism. Exercise is also a great way to relieve stress, which may be high at this time. Not drinking alcohol is the safest choice. If you do choose to drink alcohol, limit yourself to no more than 1 drink a day. Remember, 1 serving equals 1.5 ounces of hard liquor, 12 ounces of beer, or 5 ounces of wine. Drinking alcohol can disrupt your sleep and make it harder for you to exercise and eat healthy, and that could have a negative effect on your immune system. Choose to breastfeed. Breastfeeding is ideal for mom as well as baby. Try to breastfeed exclusively for 6 months after giving birth and continue even when other foods are introduced. Hormonal changes during lactation not only delay the menstrual period, but also reduce your lifetime exposure to the hormone estrogen, which can promote breast cancer cell growth. During pregnancy and breastfeeding, you shed breast tissue, which can help remove cells with potential DNA damage that could result in breast cancer. Breastfeeding can also prevent your child from being overweight or obese later in life. Being obese can put your child at risk for many cancers, including breast cancer. So, women at increased risk may need certain medications or other medical exams or even genetic counseling. Talk to your doctor if you have one or more of the risk factors we discussed earlier, or if you ever have a clinical concern. Another question, click the thumbs up button if you think a woman can develop breast cancer even if she has no family history of the disease. And this is true. More than 75% of women with breast cancer have no family history of the disease. A genetic counselor reviews your family's medical history and performs a hereditary cancer risk assessment. Based on that assessment, the genetic counselor may recommend additional genetic testing, which is a simple blood test. The blood test provides information about any genetic mutations, such as BRCA1 or BRCA2 mutations, that may increase your risk. Preventative measures that your doctor may discuss with you if you are at increased risk include preventative medications and preventative surgery. Studies have shown that the drugs tamoxifen and raloxifene reduce the risk of breast cancer in some women. Preventative mastectomy, which is the removal of one or both breasts, is another option for women at increased risk. Click the thumbs up button if you think treatment is more successful when breast cancer is detected early. And the answer to this is true. In fact, 96% of early breast cancers are treated successfully. This underscores the importance of regular mammography after age 40. MD Anderson and other institutions, including the American Cancer Society, recommend that women be familiar with their breasts and what looks and feels normal for them, rather than conducting a formal breast self-examination. So there's no right or wrong way to do that. Touching can range from unconscious, informal touching, such as in the shower, to conscious touching to feel for any changes. This shift to breast awareness was made for several reasons. Breast self-exams confused women, so some women weren't sure if they were conducting the exam in the right way, and because of that, many women just chose not to do it at all. And research has not actually shown a benefit for women in finding breast lumps by following a certain technique. Women found cancer without any training or technique. In fact, MD Anderson breast oncologists observed that most of their patients found a breast lump or other symptom of breast cancer when they were going about their own everyday activities, like showering or dressing or scratching. You should report changes to your doctor when they persist for 2 weeks or more. And again, always discuss any concerns with your doctor immediately. Click the thumbs up button if you think mammography is safe. So the answer to this is true. Although it can be uncomfortable, it is not harmful to the breast. The modern mammography machine produces X-rays with a low radiation dose, but a high quality image. The dose of radiation from a screening mammogram is about the same exposure you get from radiation in your natural surroundings, called background radiation, over an average 3-month period. A mammogram is an X-ray of the breast. A screening mammogram is a test to look for breast disease in women who have no symptoms. On the other hand, a diagnostic mammogram is for women who have symptoms such as a lump or skin change or nipple discharge. During mammograms, 2 plates press the breast to flatten and spread the tissue. The pressure lasts only a few seconds, and although this may cause some discomfort for a moment, it makes it possible to get a good picture. Very low levels of radiation are used, and the low level of radiation used for mammograms does not significantly increase the risk of breast cancer. Now, 3D mammography, or tomosynthesis, is an FDA-approved advanced technology that takes multiple images, or X-rays, of the breast tissue to create a 3D picture of the breast. Multiple images of breast tissue slices in a 3D image give the doctor a clearer image of breast masses. So this technology makes it easier to detect breast cancer. For the mammogram, you undress above the waist and you will have a wrap to cover yourself. A technologist will position your breast between the paddles and the pressure lasts only a few seconds. A screening mammogram consists of 2 images of each breast. It takes about 20 minutes. You should get your results within 30 days or sometimes even sooner. A diagnostic mammogram may consist of 3 or more images and may take longer. About 1 in 10 women who get a mammogram will need more pictures taken. Most of these women do not have breast cancer, so don't be alarmed if this happens to you. Only 2 to 4 of every 1,000 mammograms lead to a diagnosis of breast cancer. Mammography is an important tool to detect breast cancer, and no other test will take the place of a mammogram. Women with a higher risk of breast cancer should talk with their doctor about the best approach for them. They may benefit from starting mammograms when they are younger or having additional tests. If you're at higher risk, your doctor may recommend an ultrasound or MRI, which is magnetic resonance imaging, to be done along with your mammogram. As we've discussed today, there are many things that you can do to help reduce your breast cancer risk or detect it as early as possible when it is more easily treated. MD Anderson is here to help you. MD Anderson provides the entire spectrum of cancer care, from prevention to survivorship. If you think you have cancer or you've been diagnosed with cancer, it's important to get the right diagnosis from the beginning. MD Anderson often corrects misdiagnosis and prevents patients from undergoing unnecessary procedures and treatments. That's why it's important to start at MD Anderson if you or your doctor ever suspect you have cancer. To schedule an appointment for a screening mammogram, visit www.mdanderson.org/mammogram or call the number on the screen. Screening mammograms are available at multiple locations, including the Medical Center, the Woodlands, West Houston Diagnostic Imaging, and League City. Saturday appointments are also available for your convenience. And with COVID-19, early on in the pandemic, you might have put off your routine medical appointments, including your annual mammogram. As long as you're not feeling sick or having any symptoms, it's safe to get a mammogram. Some of the key precautions we are taking to keep patients safe include screening everyone for COVID-19 symptoms at all our entrances, providing medical face masks for everyone to wear, spacing out appointments, and limiting seating to allow for social distancing. And remember, mammograms at MD Anderson are read by a team that only does breast imaging. We have the latest and most precise imaging technology, a strong culture of safety, and exceptional expertise. This means our patients need fewer scans and get a correct diagnosis the first time. Thank you all for your interest in learning how to reduce your risk for breast cancer. Again, I appreciate the opportunity to speak to you all today. Please visit our website for additional information regarding any cancer prevention questions you may have. And I'm also free to take any other questions at this time.
Dr. Patel, we've had one question so far. Can you address male breast cancer?
Yes, so this is something that I feel like I get every time I give a talk on breast cancer. And so males do get breast cancer. The incidence is a lot lower than females, obviously, but we do get quite a few males that present. And usually when they present for imaging, we start with diagnostic mammography because males are presenting with symptoms. So they will often present with palpable findings, any sort of nipple changes or nipple discharge, and even areas of palpable abnormality, maybe closer into their underarm axillary region. So it's very important that even for men, if they notice any changes, including palpable findings, nipple changes, nipple discharge, all of those things still apply to men, that they talk to their doctor and get scheduled for a diagnostic mammogram right away. Now, depending on the patient's age, when it's a male patient, we may choose to start with ultrasound in younger patients or start with a diagnostic mammogram even in men.
Great. Dr. Patel, we have another question. Can you elaborate on tamoxifen?
So there's different medications that are given to patients to reduce their risk of breast cancer, and these are specially prescribed in our cancer prevention clinic, in our high-risk clinic. And so this is not something that you would take as a person, in the general public. This is something that you would take only if you have, typically it's patients who have had atypical ductal hyperplasia, any sort of atypia on prior biopsies, and they get put into that increased lifetime risk of breast cancer category where they would benefit from risk reduction medications. And so that's where tamoxifen and raloxifene start playing a role. Again, it's not just for anybody, it's for patients who are at that increased lifetime risk of breast cancer, and specifically for patients who may have had atypia on prior biopsies. We have a really great high-risk clinic here. So anytime patients have come back with a biopsy result of atypia or any other high-risk lesion, even at outside institutions, we see these patients here. We have a multidisciplinary conference where we discuss the cases with a radiologist, a pathologist, a surgeon, and we decide on what the best course of action for those patients may be, whether it's surgery or whether it may be one of these medications in lieu of surgery. So that's something that's more of a specialized way of handling patients who are at higher risk.
Wonderful. And Dr. Patel, one of our participants is asking if you could explain what metastasis is.
Sure. So when breast cancer moves out of the breast into the lymph nodes under the arms or any other part of the body, such as if it goes to the liver or the brain, that's what we call metastasis. So the first time we see patients when they come to us with a new diagnosis of breast cancer, we typically approach the patient with the mammogram, and we do an ultrasound where we scan the breast, and we also scan all of the areas where the lymph nodes are around the breast so that we can see if the cancer may have spread to any of those lymph nodes, because that's usually where we would expect it to go first.
Wonderful. And Dr. Patel, we had another question come in, and I think you've briefly gone over this, but can you explain what people will expect when they're coming in for a mammogram, and by chance if it led to a cancer diagnosis, what does that look like? What are the steps look like?
Sure, I think that's actually a great question, because that's what everybody is obviously scared about. So typically what happens is if you come in for your screening mammogram, you would check in, change into the robe, get the imaging portion done, just like we talked about with the compression and 2 views of each breast. And then some facilities will, depending on where you go, will read the exam right away if it's a screening mammogram. And some have technically about 30 days to get the report out to you. So then the report is given to the patient, whether it's by mail, verbally, every facility may be a little bit different. Now, I think this question is specifically asking about abnormal findings. So if there is an abnormality on the screening mammogram, the report will typically indicate that additional imaging is required. Now, that does not mean you have cancer. So again, if you have a screening mammogram and it says that there is something that looks abnormal and additional imaging is required, that simply means we want to take a closer look at that specific area. So you come back for the diagnostic mammogram, in which case the technologist will take additional pictures of the area of interest, and we may or may not also get the ultrasound. Now, if there is an abnormality on the mammogram or the ultrasound, a biopsy will be recommended, and that will be scheduled. After that biopsy is performed, the results will come in, and typically the referring clinician will get the results and they will communicate the results to the patient. Now, we have a great nurse navigator available at all of our facilities. So anytime we have a newly diagnosed breast cancer patient, we have our nurse navigator automatically start working on the background to help get the patient scheduled. Typically, they'll get scheduled with a breast surgeon first so that we can start getting them in for their subsequent appointments and for their care. And then after that, the radiologist may or may not play a role in the care of the patient. Depends on if additional biopsies are needed or requested by the surgeon. So the surgeon kind of takes over management of the patient at that point.
Wonderful. Dr. Patel, we've had another question come in. I'm going to read it to you. It says, I am a triple negative breast cancer survivor. I went through chemo, surgery, and radiation for almost 9 months at MD Anderson last year. My question is, what recommendations you would make to prevent any other type of cancer during my survival journey? For now, I am doing well and feeling good, and I am so grateful for the team at MD Anderson who all took care of me.
Oh, well, we're happy that your outcome was so great and you had such a great experience here. I think all of us try very, very hard to make sure that all of our patients have a similar experience. Now, in terms of additional cancers, Laura, was there any additional cancer?
Yes.
We have a cancer prevention clinic here that would specifically kind of do more of any additional screening for you. So they would go through all of your family history, your past medical history, and see if you are at risk for any additional types of cancer, and would get you into the appropriate screening for those cancers. For example, for any patients who may be at high risk for skin cancers, we have the Cancer Prevention Clinic can help and make sure that you get your exams, your screening, your screening exams, physical exams, to make sure that we're kind of checking your whole body and the skin specifically. The other thing they will assist with is making sure that you get your cervical exams and all of the other preventative exams done appropriately. So I think the high risk and cancer prevention clinics are the best option in these cases, because they would cover kind of in a broader spectrum, not just breast cancer.
Wonderful. Another question. With 3D mammography, do you think it's hype or an advance?
I think it's an advance. It definitely is a lot of images to read on the radiologist's part. However, I have seen it show cancers that we would have had a very, very hard time seeing on 2D mammography. So I personally think it's very beneficial. I do think it's extremely beneficial, particularly in women who have more dense breast tissue. So whenever you get your mammogram letter, it always comments on your breast tissue density. There's four density types. And so the patients who have more of that dense, heterogeneously dense, extremely dense breast tissue, I think it can be very helpful. And that being said, I've also found tiny lesions in patients who have more fatty breasts on 3D mammo. So I really like 3D mammography.
Wonderful. Okay, Dr. Patel, this question has just come in. My sister had a biopsy and was asked to take tamoxifen, but she is not comfortable taking it. Is it okay to not take tamoxifen? Who can she reach out to at MD Anderson for help?
So I actually would, that's a great question. And I know that there are side effects to these medications, so they're not always easy to take. However, anytime you're going to stop your medication or change your medication, I think it's very important to reach out to the doctor who prescribed it. Specifically at MD Anderson, our high risk clinic is a great resource for this particular patient. I think that they should reach out to the high risk clinic and get more information on perhaps, the background. They can give them more of a background on the importance of the medication or other alternative options if they aren't able to take the medication. But again, talking to the doctor and making sure they talk to the high risk clinic specifically is very important.
Wonderful. Okay. With triple negative breast cancer, what is your success rate for complete recovery, or is that rare?
We've had patients do very well with triple negative breast cancer. In terms of the specific success rate, I'm not 100% sure if I know that off the top of my head. We do have some trials right now that are ongoing specifically for triple negative breast cancer. And so some of our medical oncologists are available, and those specific trials for triple negative breast cancer are also listed on our website. So I think if later on, if somebody does contact Laura via email, we can give them more additional information regarding the trials that we have available for triple negative breast cancer. But we do have patients who do very well.
Wonderful. And at this time, I believe that is all of our questions. Okay, hold on. We've had one more come in. They would like to give a shout out to IACCGH, a volunteer organization that helps people navigate cancer treatment. Thank you for putting that out there. That's wonderful. We love that. But as in regards to questions, I believe that is all we have at this time. So I'm going to go ahead and turn our presentation back over to Jagdeep. On behalf of MD Anderson, I just want to say how thrilled we were to be here today presenting, and to thank Dr. Patel for her time and efforts in helping us educate the community about breast cancer and breast cancer screenings.
Thank you very much, Laura. Thank you very much, Dr. Patel. As the spouse of a cancer survivor, I know how important this information is, because I remember when we first got the news of my wife having the disease, we broke down. It was a very shattering experience, but what I loved about MD Anderson was the compassionate care that we received there. I loved the treatment that Dr. Richard Theriault, who was her treating physician, the time he took to walk us through the whole process. And I'm glad that Dr. Patel answered a lot of the questions that we had today. One of the things that we were told during the treatment was it made a lot of sense to come back to MD Anderson for the radiation. And the reason for that was I was told that at MD Anderson, you have specific equipment set for each part of the body. The calibration is of the highest order, and the possibility of the radiation being targeted and done the right way was very, very important. So we were privileged to be living in Houston, and I was reminded that people fly in from all over the world to come to MD Anderson for treatment. For us, it was just a drive to downtown for the treatment. And I'm privileged and proud to state that she is a 10+ year survivor. So we were fortunate to be living in Houston. We were fortunate to detect the cancer in time. And we were fortunate to be treated at, in my opinion, the best cancer treatment center in the world, MD Anderson. That's my personal story. So I have a special personal vote of thanks on behalf of my family to MD Anderson for the compassionate care that you give to every patient that comes in. I'd also like to share the fact that as a volunteer, I was part of the group that convinced Dr. John Mendelsohn to go to India to connect with similar centers of excellence in India. The real driver behind the initiative was our founding president, Dr. Durga Agarwal, who didn't give up. He insisted on pushing the relationship forward and convinced both Dr. Mendelsohn on the US side and Katie Dinshaw, who at that time headed Tata Cancer Center, in talking to each other, which ended up in a relationship which has lasted. He was also responsible for connecting MD Anderson to a center of yoga excellence in India, which led to Lorenzo Cohen at MD Anderson incorporating yoga as part of the therapy for post-cancer treatment. So the chamber takes pride in having a long-term relationship with MD Anderson, and we look forward to continuing this relationship. I was talking to Laura and Dr. Patel in our pre-event meeting. We would like to poll our attendees and the community to ask what other topics in cancer treatment they would like us to bring up. One of my suggestions was prostate cancer for men. So we could follow today's presentation with another presentation in partnership with our sister organizations in Q1 of next year to serve the community with the right guidance and advice. With that, I want to thank all the attendees who made the time to join us. I really want to thank all our partner organizations who are making the effort to not only join us, not only to publicize this, but to also give a live feed out to the community so that the message spreads far and wide. We will be saving the recording on our website. We will be emailing it and sending it to our sister chambers in India, both IACC, the National Chamber in India, and the PhD Chamber in Delhi, for them to share with their members. And hopefully the advice that Dr. Patel gave will be of value to anybody who sees the presentation. And we hope that if anybody needs advanced treatment, they will head towards MD Anderson. On behalf of the chamber, we also want to offer special thanks to Angela Belcher for her support. I want you all to join me in thanking Bhavna Kalyan Bagga, who makes these webinars work. We want to thank Laura De La Rosa and Dr. Meryl Patel for today's presentation. All our collaborating organizations whose logos are visible on the screen, thank you every one of you for your support. Our partner organizations who support us on a continuing basis, our media partners who help spread the word. We invite you to join us at our upcoming events. The next one being Women Mean Business. And this will be a very interesting event sponsored by Shell. Shell has been a long-term partner of the Chamber and supports both the Distinguished Lecture Series and the Women Mean Business Series. And Marianne Maladona is the CEO of the World Affairs Council of Greater Houston. And Nora Angel is the president of American Leadership Forum. These are two organizations that I encourage all of our attendees today and the community at large to learn more about. We decided to have these two CEOs of two nonprofits talk about coping in COVID and also sharing their life story. The event, which thanks to Joya Shukla, one of our past presidents, has been an ongoing initiative modeled on the Shell Pearls of Wisdom series for women, in which women of eminence are invited to share their life story and interact with the attendees. We invite you to register for this event on December the 15th and to keep visiting our website, IACCGH.com, to stay connected. If you would like to be on our mailing list, you can reach out to us at info@IACCGH.com. Thank you, Bhavna, for putting up the event for the farewell for Congressman Pete Olson. This is going to be an event to say thank you to Congressman Pete Olson, who will be leaving. He had decided not to run, and he's been a strong supporter of the community. In fact, he was the reason we launched the Power Dialogue. When he took office in 2013, he reached out to the chamber and he said he would like to host a lunch for some business leaders who are members of the chamber. So that is what led to the launch of the Power Dialogue with elected officials, and we've been carrying on since then.
it is very fitting that we would give him a farewell. And one of our former board members, Dr. Subodh Butcher, will be in conversation with him. And the Consul General of India in Houston from India, Mr. Asim Mahajan, will also be joining us as the chief guest at the event. With that, once again, I want to thank Dr. Miral Patel and Dr. Laura De La Rosa for today's event. It was a great event. Thank you very much. With that, thank you to all our attendees. Today's event comes to a conclusion today. See you at our next event. Stay safe. Good evening and bye-bye.